The Amen Clinic is in this large Valley Medical Center, and it's got its own private entrance. Right here. And so this is where I'm spending 3 days going through a battery of testing to determine my cognitive capability and either to set a baseline so that I know in the future what my memory level has been and can measure deterioration from that, or to find that I have some level of cognitive challenges and to be able to specifically see what those are about literally through the brain scans that will be done here and the other testing program. So this is a 3-day program. It's costing me $3,500. It's led by a gentleman named Dr. Amen, who I've been interested in for many years for his program of being sort of the guru of brain scans and being able to interpret that. And then once you can see what's in the brain, you can diagnose it, treat it, and then come back again and to scan the brain and to determine the progress of improvement in optimizing one's brain capability. So I'm shooting other videos inside, but this will give you an idea of where I'm at and what the facility looks like, at least from the outside.
Okay, so my name's Parker. I'm a nuclear medicine technologist. I perform the brain SPECT scans here at the Amen Clinics.
Can we look at my results?
Yeah, so we can look. So with Martin, he took the test yesterday. Today he's going to be doing his second scan, so he'll just be resting in the chair today rather than taking this test. But with his test, like I said, it's a test for attention deficit. His results, it grades us on different criteria. The person is trying to see letters on the screen, and every time they see a letter, they hit the space bar as fast as they can, and they try not to hit the letter X. So with this test, it's measuring different criteria like the reaction time, how many times they hit X, how many times they didn't hit X, how many times they correctly hit the other letters, and how that reaction time changes throughout the duration of the test. It's about 14 minutes. So the first 5 minutes you may be very vigilant and doing well, and then the next 5 minutes you kind of wander off, and then you're back to being vigilant again on that last 5 minutes. It just kind of varies. So if anybody, and what this is doing is it's comparing your speed in the times you hit X compared to the norm. Of the thousands and thousands of people that have taken this test, it's comparing the averages. So if you have an out of normal average, then your score would be up in this dark gray area. I don't know if you can see that on the camera. But with this dark gray area, that would be a potential sign of attention deficit, different aspects of it. And with Martin, the only kind of possibility is he has some vigilance. Throughout the test, his vigilance on the test may have changed a little bit. He might have gotten wary after 6-7 minutes and gone back into it. But overall... So
what does vigilance mean, though?
Vigilance is how well you were focused on the test. Okay. How much did your focus waver?
So if my mind drifted, the vigilance would not be good.
Yes, and that's what can tell you drifted a little.
Parker, you've been immensely helpful to me, and a part of it's not only your technical results, but your willingness and desire to share openly and to have me and others through the video be able to know what's going on. Why don't you tell us a little bit about yourself, Parker, how long you've been with the Amen Clinic, and anything about Amen that you want to say, and whether this really works.
So I've been working in nuclear medicine for about 3 years. I've been with the Amen Clinics for about 2.5. What nuclear medicine is you'll find it in a hospital. It's a branch of radiology. If anybody has ever had to go through a heart study, if you're running on a treadmill and they give you an injection and put you on the camera, nuclear medicine is involved in that. They're the guys that come in and give you the injection. PET scans that are with cancer. A lot of people they have cancer, they're worried about the cancer spreading, they'll do a PET scan. PET scan is also my profession. And so I did work at a general hospital before.
So you do the follow-up scans, and hopefully those are when things have improved, and you probably get to talk to the patients. What do you hear from the patients relative to how this has changed their life?
The best way I can describe that it's changed their life is, when they first get that scan of the brain, when they first get that printout, they can physically see their brain and see how it's functioning, it makes you want to take care of it. Your brain is something that, I've always been told I shouldn't smoke or I shouldn't drink alcohol because it damages my brain. You don't really think of it that much because you don't really have much to look at. You don't have like a physical reminder. And so when people get these brain scans done, they immediately have this, they see their brain and they see exactly how they can take care of it. And it just kind of gives you that physical reminder. It's almost like a flower or plant or something that you just need to fertilize and water to keep it alive. When you see this picture of your brain, you say, okay, now I know what I need to take care of. And when they come back and get that follow-up scan, they can actually see what their hard work has done. It's not easy to, if you have to change your lifestyle, it's not easy to give up alcohol. It's not easy to change your lifestyle if you have to eat healthy. Those aren't very easy things to do. And when people see where that hard work is done, those supplements, the hyperbaric. And I look forward to that. While at the same time, seeing in the brain is one thing. Really, the major thing is do they regain cognitive capability? That's the measure. So what is your feedback? What are they telling you as to what's happened to their cognitive capability? So a lot of times when people come in with like memory issues and things like that, they describe it almost as a fog. When you're trying to think of something that happened, it's almost this mental fog. And you know that you used to know that answer, or if someone asks you about something, you say, oh yeah, I remember my neighbor, but I can't remember their name. There's always that little fog that comes. And with a lot of our patients, it clears. They say, I start remembering things a lot better, a lot faster. I'm feeling happier, I'm feeling better, I feel more in control. That's a lot of times what we're seeing is that fog is clearing, they're more acute, they're precise, their memory is faster, more clear, and then just the general kind of overall wellness, the happiness that they have.
And you get those reports most of the time? Are there other times when
Majority of the time, yeah.
Okay.
I'm not sure in a percent. From what I've seen, maybe 80 to 90%. Sometimes the ones that don't show it are maybe just the ones that didn't work for them, or if they were on the wrong medication or wrong supplement, and we just kind of have to.
Or maybe didn't follow it.
Or maybe didn't follow it.
Yeah.
Like I said, it's not easy changing your lifestyle if you have to. So a lot of times if they weren't following it, so it's just we kind of go from there. We continue treating and seeing what we can do, and we always try to do the most health, like the best approach. We don't want to prescribe medications that are toxic when they don't necessarily need it. We get a lot of people that come in with misdiagnoses just because they get some of those umbrella diagnoses like ADD or ADHD, and they're taking this medication that's a stimulant, and this whole time they didn't have ADHD and they didn't need that stimulant or that toxic medication. We can remove that, replace it with a supplement if we can, or even just wean them off of that medication. They still get the same results. They feel happy, they feel focused, but they're not causing that damage to the brain.
Parker, what a privilege. Thank you so much. You've given a gift to many of us now.
Yeah, no problem.
With this. Okay, here we go.
Nothing in your pockets that might fall out.
Yeah.
Just don't want anything to hit the floor.
Yeah. Get stuff out.
And then when you're sitting down, be sure not to kick your tripod or anything.
Okay. Try not to do that.
There we go. All right. Good. Go ahead and lay down. Probably scoot back about a foot.
Whoops.
Those aren't attached to the camera. Those are just arm boards. There you go. Go ahead and lay back. Rest your head. There you go. Perfect. We'll make sure you're centered. It looks good where you're at. Would you like that wedge underneath your legs?
Yeah, that worked really cool.
So I'm just placing a wedge under
This
his
was
legs.
the most relaxing 20 minutes that I've had in a long time. So
Blanket?
I described in the video, well, maybe it's not yet in the video, that the test on the computer was like playing a computer game for 15 or 20 minutes.
Uh-huh.
And this was the best relaxation that I've had in a long time.
Yeah.
That this has been an amazingly pleasant experience, and
Good.
not only from the equipment and all, but how well you have shared and made this comfortable to do. What I think probably all of us come here with a significant amount of anxiety around it.
Yeah, a lot of times this is a new experience for
Yeah.
everybody, so I like to explain best I can to kind of relieve
It's
some of that
very
anxiety.
helpful. I
Right
guess
on.
the final
There you go, perfect.
the final anxiety is when we see the actual scan and see whether there's really a brain in there.
Yep. This wrap is just to help keep the head still. That way, if he falls asleep, he won't move his head by accident. And all it is a simple disposable wrap that I just toss after each scan. You know, I don't want to use something that's going to touch everybody's head and have to clean it after. No, it's just easier to throw something away after it's done. Alright, so we're going to start heading back. We're only going to go to about your shoulders. Now on camera, we're actually going to be able to see his brain up here once he starts rolling in. This screen refreshes every couple seconds.
Cool.
I'm going to go to about the shoulders. About right there. Alright, good. So the only reason I'm slowly inching him in a little more is because I'm making sure that I'm getting the whole brain in the scan. So you can see a little bit the bottom of his brain right there. I'll zoom in on this. But that's from the back of his head. That is the right side and the left side. This is head 1, head 2, head 3, and you can see the dots on this big squares right here, the big cubes. Those dots are telling me which detector it is. So that's head 1 right here to the left of his head, head 2 right there on his right side, and head 3 is below him. So I'm going to rotate this so that we bring head 1 underneath him, just because that is the starting position for the camera. There we go, looks good. And I also do this to make sure I'm not going to bump his nose a little bit or anything while it's revolving. It might rub his shoulders a little bit, that's normal. It actually has sensors in here. If it were to touch the person, it will turn the camera, it'll shut down the motion. Alright, so it looks good where we're at. I'm going to go get the camera ready so we can start. I'll be back in just a second. Just double checking. Alright, ready?
Yep.
Here we go. So scan is starting. Perfect. Alright, so scan has started. It's just going to slowly make its way around his head. You can see the image here is getting much clearer, so we can see his brain a lot better. There's the back of his head now. Remember, head 1 is underneath him, so that's head 1. Head 2 is on his left side right there, and head 3 is on the right side, right here on his right side. It's just going to slowly rotate. You can see that brain right there. There's a little bit of activity in his cheeks. That's his salivary glands. Alright, I'll come get you when the scan is done. Hold on.
Party, it's over, huh?
If you didn't move at all.
I get good scores as a patient.
Scan went really well. Slide this little wedge up from under you. Watch out for your tripod.
That's
Okay, so that is the raw data of the scan. Basically, you can see your head is going around in a circle. That's just the images that we acquired here on the camera, but they've all been put together now. And you can see that nice kind of cinema going around in a circle. And what that's telling us is that you have a brain and that you did not move. Now, there's not too much else we can tell from that yet. We can't tell what's going on inside the brain until we process it. That spiral that you see in the middle, that is just the same thing, just kind of laid out in a graph for us to look at. And it shows if there's been any movement, you would see some horizontal streaking through the spiral. So the scan turned out really good, really well. Once we process it, that's when we'll get those nice 3D images that you'll be receiving with the doctor tomorrow.
Great, thank you. Good morning.
Good morning. Okay, so I am Dr. Faber. I've spent about 30 minutes already this morning looking at your pictures, your lab work, and I took a bunch of notes. So here's what I'd like to do.
Okay.
I want to spend about 10 to 15 minutes asking a few more questions, just getting some clarity on some things.
Okay.
2, we'll look at your pictures for about 70 minutes, and I'll throw all sorts of ideas. And then 3, the last hour, I'll type up all your notes for you. Okay?
Cool.
All right, okay. Okay, in your mood, how's your mood been?
Really good and amazingly good. This whole experience has been a really good experience for me, despite the fears associated with what you're about to tell me.
So it's kind of anxiety provoking, huh?
Oh, sure.
Yeah. All right. That's like 98 to 99% of people, especially when you show
And the other
pictures
one
before.
lies.
How long have you gotten so compulsive about all this? Because this is really...
When I got diagnosed as being pre-diabetic a year and a half ago.
So a year and a half ago, that's when you got on that serious diet?
You bet. I went from eating a hot dog every day and a big gulp to never again.
Okay.
And I mean, I eat spinach and avocado, and I've studied everything that every book says.
And a lot of it, there's some conflicts, but there's a lot of similarities with the healthy stuff as well.
Yeah.
So, okay.
I'm on a ketonic diet.
Yeah.
Okay.
And you're eating 1 meal a day from what I
That's
saw
right.
now? Okay, and you're doing 12,000 steps per day?
Averaging.
Averaging 12,000 steps per day?
Yeah.
Yeah.
And so I'm
Wow.
just into a
So
lot
you're
of
really active, involved
I'm
in the
very
community,
active.
and it sounds like you've really put the pedal to the metal the last year to health, focusing on health, brain health.
Hey, there's nothing more, and the fact that I'm here spending,
More money, yeah, and time.
it's
Good Lord
the
Almighty.
third largest amount of money. I've bought a home, I bought a car, and this is the third
Wow.
largest investment in myself.
Okay, the process that we do. I'll show you some pictures of what we expect to see, and then we're going to look at your stuff.
Cool.
Okay? So I was going to show you this first. This is your web neural. This is the test with the mazes and faces that you did.
Okay.
All right. So I'll walk you through. We color code scores. Light green to dark green is what we like to see. Orange and red, those are opportunities for improvement. Numerically, 3.5 is the cutoff score. So anything around 3.5 we get more watchful of as well. Okay? Okay, so we break this into 4 sections: thinking, which is a composite of focus, memory, and executive functioning. Emotion, this is how well we recognize the faces. Feeling, that's how you felt during the assessment. And then self-regulation kind of speaks for itself. All right?
Got it.
As we get 2 scans, day 1, I'll walk you kind of through what we do. We have you come in, we give you an injection of technetium, it's a radionuclide. We give you the same amount of radiation as we do from about 1/3 of a CAT scan. That's relatively mild. If you compare that to radioactive iodine for like your thyroid, that's in your system 3 days, and you're shooting off all sorts of radiation, so you can't be around anybody. The stuff we give you, about a 1/16 of an inch from your skin, it's gone, and it's out of your system within about a day. All right. So once we give you that, then we have to go to our crazy computer room, where we have you press the button.
The X's.
Yeah, you press every letter except X. Everyone thinks it's easy. I don't think it's easy at all. It's pretty
Hey, my profanity was uncontrollable.
It's hard. But it gets your brain real active, so that's the main reason why we do it. So we'll do that for about 25, 30 minutes, 20 to 30 minutes. Then we'll have you go from our little computer room to the scanner. The scanner we lay on that flatbed and then roll your head in between those 3 big boxes that form a big circle. Looks like a little miniature MRI machine. Those boxes are gamma cameras, and what they do is take pictures as they rotate around your head. It takes about 15 minutes for those cameras to do their full revolution, so once they get to the top, boom, we're done for the day. That's your active scan. Day 2, come on back. This time, and usually thankfully, no computer games. We just have you sit and try to relax for about 20 minutes. Once that time's up, we'll go from our little quiet room back to the scanner room, lay back on the flatbed, roll your head in between the 3 big gamma cameras, let them take pictures for 15 minutes, and then you're done. That's your resting scan. So you get the active scan, resting scan. Now what I do is look at 2 different types of pictures of your brain. So the first thing we're going to do, okay, so there is your brain. Now, when I read your report, here's how I kind of think through things, all right? Looking from the top, if I see a bunch of bumps and holes, primarily in this middle third, okay, we get a little bit concerned about that being associated with pre-Alzheimer's disease. All right, so we definitely want to look for there. With memory, we'll look at temporal lobes here too. Both temporal lobes should look like 2 fluffy cotton balls. Nice, fluffy, smooth on top with a good convex surface protruding out. If this was clay, I do not want to take my pen and from the outside start pushing in, or from the inside start squeezing out. So if these start to shrivel up and look like prunes, we got some issues. The other thing I'll do, here's your left temporal lobe, there's your left temporal lobe. This indentation correlates to right here on the side. If I were to take my pen, and push it into the clay and make a big tunnel, then I know I got some temporal lobe issues there as well. Okay, so we're going to look for that as well. By the way, do you remember that test with the clocks? You'd draw the clock?
Mm-hmm.
It's called the SAGE test.
Mm-hmm.
You can score anywhere from like 0 to 22.
Mm-hmm.
If you score below 17,
Mm-hmm.
or 17 or below, then you've got mild cognitive impairment. You scored an 18, okay? So you're getting close, all right? But
Okay.
you don't have mild cognitive, at least according to that test.
Yeah, and that would be my self-assessment, incidentally.
Yeah, so that's part of what I was asking those questions before. It's like, God, which to me, that was good news.
This, incidentally, you're allowing me to do this is a big deal. I would never,
Sure.
nobody'd ever remember all this
No,
stuff.
there's no way. I usually let people, like, they'll bring their tape recorders, but yeah, no, this is your time.
Oh,
and
this,
the more we can
but
give you,
adding the visual is
it
just
helps, doesn't it?
magnificent. Oh, yeah.
Yeah.
Okay.
I go from here to let's go on top. All right, can you see that little, it almost looks like a little valley
Yep.
here? Okay, that's part of our longitudinal fissure.
Mm-hmm.
Okay, there. As we get older, we do get some less blood flow here, although this could also be from head trauma. 1 to 4, this is kind of like a 2 range.
Okay.
Okay, the rest of your frontal lobes, though, besides there, look pretty dang smooth. All right, we get to the temporal area on top,
Mm-hmm.
not too bad here. Then we get to this kind of parietal area. See these little bumps here?
Yep.
It's got like a little 2 there. And got a little 2 there as well.
Okay.
Got a few in your back occipital area too.
Okay.
All right, now, when I see this pattern, this could be from a past hit to the head. There's been no head traumas. I didn't see any
Not that
in
I
the
know.
report. Okay.
I remember.
That you
I
can
always
remember?
qualify that I remember.
Yeah. But we'll let people get hit like when they're 2 or 3, and it's hard to remember that. But
Yeah.
it could be that. Do you snore when you sleep?
No.
Okay, because sometimes with sleep apnea, we'll see a lot of bumps kind of go in this area we're seeing right here. That area of our brain's like a watershed area. It's like where the blood flow from both your back posterior and your middle cerebral artery, the last blood flow goes to that area. So if we have problems with breathing at night, that area is more susceptible. Could be, maybe, although I'm a little bit hesitant to say it because we'd see it more up here, maybe early like degeneration here, like with some Alzheimer's, although I don't think that's the case, but we want to get really like you're doing, compulsive on making sure we get more blood flow through here. Okay? To that. I'd like to see this a little bit smoother. Okay? Frontal lobes look pretty good, but we get to that parietal occipital area, I'd like to see a little bit better. All right. Temporal lobes, I want to see 2 fluffy cotton balls. See how this one on your right side's get a little bit smaller in here?
Mhm.
All right. Then here, left side and right side.
Not enough cotton.
Yeah. Your hippocampus, so memory.
Okay.
All right. Now that you brought up memory, I can see where we might have some issues here.
Okay.
Remember how I said I want to see how much pushing in we got
Yep.
in these areas? Okay, so here's left temporal lobe, left temporal lobe. Can you see that there?
Yep.
Right temporal lobe. This should all be color. Can you see right here?
Yep.
Okay, so we can definitely have some memory stuff going on here.
Okay.
We're gonna really want to focus on these temporal lobes. All right, now I want to mention something else to you. All right, so Alzheimer's here. If we start to see a lot of bumps and holes in this top third, including underneath our temporal lobes, there's something called frontal temporal lobe dementia. Okay, you don't have frontal temporal lobe dementia from looking at your scores, but these signs could be early kind of indicators. We want to get really aggressive and
Okay.
helping more blood flow get to these areas.
That's what I'm here for,
Okay.
really. That's the bottom line.
Yeah, so we're going to talk
What
about.
am I going to do about it?
Yeah, so we want to do some things to help here.
Cool.
You also, right here, I'd like to see your cerebellum be a bit more filled in.
Okay.
And I see this, we call this a posterior cerebellar notch. Have you had an MRI of your brain ever?
No.
Okay. Sometimes we'll see this pattern if your cerebellum starts, there's a little bone with an opening here called the foramen magnum. If our cerebellum starts to herniate through that area a little bit, we can see this pattern. So one of the things I'm going to suggest, just to make sure that's not happening, we get an MRI
Okay.
and check there. This is a typical picture of a male brain aged 51 to 69 years old. In terms of our normal pictures, we only go up to 69. So when someone's in their 70s, we have to use this picture. All right. All right. Now these are a lot different looking, so we're going to walk through and try to make some sense of these first.
Cool.
Just to orientate. Bottom up again. These line up just like those other pictures. Top down. Left side. Right side. And resting. Active. All right. All these line up. So I'm going to start at the bottom at our cerebellum and work our way up. Okay?
Go.
All right, so cerebellum, like to see a lot of red and white. Our motor and thought corridor. Looks pretty good. You got that little notch in your cerebellum on the outside, but that looks pretty dang good. Okay? That looks whiter than this picture.
Okay.
All right, so that's even better.
So what does that mean? I'm motivated?
Well, your motor and thought coordination, so in
Yeah.
terms of motor coordination, but thought coordination, our working memory processing speed, how fast we learn.
Okay.
Okay. Then our thalamus, we should have a little red spot. Okay. Here it's a little bit whiter than that. Okay. Higher association with depression or apathy. Association is the key word because I don't think you're depressed. We're still going to talk about this for another reason though,
Okay.
as well.
I don't think I'm depressed either.
No.
I'm actually feeling better about myself than I have in years.
Years.
And a part of it was losing the weight
Weight.
and all that stuff.
And the exercise helps.
Absolutely.
Huge. All right, so we'll talk about, there's another reason I want to talk about that. So there's
Okay.
thalamus. Then our basal ganglia, anxiety, nervous, worry, procrastination. Should have two little red dots. Can you see a little white spot there when you're resting? And look at your active. Who used to procrastinate?
Still do.
Yeah. All right, so we'll talk about that a little bit. Anterior cingulate. Depression, obsessing, should be all blue. Well, yours is all blue. Okay. We'll talk
Cool.
about that too a little bit
Cool. That's
Okay.
good news.
as well for optimizing brain functioning, and then with a few other things why. We'll talk about it as well. Okay. Now, given all this, what the heck would I recommend?
Yeah.
All right. Everything I tell you from this point forward, I'll put in your report because I'm gonna give you a lot of stuff. In my physician section, I'm gonna put like the top like 8 or 9 things I'd start with.
Yep.
All right, and then I'll put everything else in.
And I'll be
as
interested.
well.
I'm interested. I'm assuming I'm probably doing some of them.
No, you're doing something.
And I would be thrilled. This would be my cause.
Cause.
It is my cause. But to be able to convey firsthand to people, they can see all of this stuff. I mean, it would have been incredibly helpful and lower my anxiety. It'll be incredible to my friend B. I can't imagine she's not going to do this. I can't imagine anyone that watches this. Okay? Now, we'll see, 6 months from now my brain gets worse and I blame you for it. But I don't think that's going to happen.
Well, we've seen people. I mean, we've seen things get better. You know, I mean, just from other, especially our NFL players in their
Yeah.
70s now that they do the stuff. You know, if you don't do this stuff compulsively,
Yeah.
no.
And clearly you feel strongly that what you're suggesting is going to make a difference in my life.
Yeah, we got to
And
do
I'm-
it and do it.
And I'm
do
a
it,
believer.
You know, and
Okay.
then some things work, and then we start adjusting things as
Okay.
well. Okay, so psychologically, we're talking about reading, brain exercises, the books, Memory Rescue. I really like Unlimited Memory by Kevin Horsley in
Okay.
terms of using our temporal lobes. It's like more exercises.
Okay.
I don't think it's an audio book, that's the only problem, but it's a small book.
Okay.
Okay?
Small books in big print, you know.
Yeah, exactly.
Incidentally,
Yeah.
I'm fabulous. I'm a internet. If I Google something, I mean, I can research and get exactly what I want in no time.
Yeah.
Whereas, you know, books I wouldn't find it in.
Yeah.
Okay, back to you.
Okay, and I think that will be plenty. The other thing is to say you're doing good. Most people when they leave work, they're not learning and they're not doing things. And you're doing just the opposite.
I'm in high gear.
So you've got that piece, great.
Yeah.
You've got the volunteer and being around people,
Yeah.
great. You've got the diet and exercise, great. So a lot of this we're doing. We want to look at the blood flow piece. I think that's going to be really important for you. And the hormones, right, with your testosterone, especially those we want to really try to help focus on the next 6 to 12 months
Cool.
and help out. Okay. so we wanna see
Am
the
I
blood
going to
flow.
come back in 6 months and get another set of scans, or what? What's
I would wait a year to
A
get
year.
a scan. Yeah, I'd get on, keep doing your diet, and then get really fastidious about this other stuff.
Is there
we're
any
talking
other
about.
measurement technique?
Well, what I would do is we'll meet in a month, but after that, 5 months before you'd see me
Okay.
again, I'd meet me at 6 months. We get that web neural again,
Okay.
and we see where your scores are at. Oh, too.
Now, how do I describe myself? Do I have mild cognitive impairment?
According to the SAGE score here,
Yes.
I wouldn't say a mild cognitive impairment. I think we're at a place where we want to get really aggressive.
Okay, so I
help
can.
this going better.
This is a good time to stave it off.
Yeah, yeah. So the way I would just, from a diagnostic standpoint,
Yeah.
I'd say something like mental disorder, secondary known physiological cause, which is a nice way of saying, hey, there's some, slight memory problems which are still normal on that web neural that we just got to watch for closely.
Okay. What if I described it as I have greater memory loss than normal age-related loss, but I'm not yet to the point of having MCI?
That's fine. And we just don't have an ICD-10 diagnosis that
Yeah.
can say that very well.
Bredesen uses a term SCI that
Subjective cognitive impairment.
Yeah.
But there's not a ICD-10 diagnosis
Okay.
that has it. But yeah, that's a good way
but that
to put it.
is
That's a good way to put it.
okay. What do you think of Bredesen? Have you studied Bredesen's book?
No, Bredesen's good.
I
He's
see
got some good
Bredesen
stuff.
and Amen on YouTube together and so on.
They've done a lot of teamwork and have conjointly talked
Yeah.
a lot on what are good programs for brain. So yeah, no, his End of Alzheimer's, great book.
Okay. Cool.
So, yeah.
Okay, I can't tell you how much I appreciate you and this experience. I mean, this has been an unbelievably pleasant experience.
I'm glad you've enjoyed the experience. Now here's my verbiage. If all this helps
Yeah.
your memory get better, then I'm a happy camper. Because the pictures are nice to see and stuff. I love looking at the pictures, but really we want to see results now.
Okay.
And longevity and quality of life. That's what we really want.
Yeah. And thank you for letting me video and to freely share that.
No, you're welcome.
That'll be a big deal.
Yeah, no, you're welcome.
Thank
All
you.
right. Give me 30 minutes and I'll start typing away.
You can have